Hi, I'm Judith Logue. I live in Port St. Lucie, Florida. I was diagnosed with anal cancer on July 14th, 2008, 2:00 p.m.
Wow.
It's not something one forgets. I'm a psychoanalyst, professional coach, and psychotherapist, and I'm happy to bring my perspective on self-advocacy and seeking mental health support during anal cancer treatment and recovery. I'll tell you the three main points that come to mind. First, take a knowledgeable advocate who is a family member or a friend to your appointments. Take notes, research your diagnosis and treatment, and find one or more anal cancer support groups, such as acf.org. I joined a Yahoo group in 2008 because ACF was not yet founded. Second, ask for help from friends. Take it. Be specific about what you need and what you want and what you do not want. People want to save your life, and they do not know what to say, and they do not know what to do. Do your psychological work and figure out what you want and need and ask for it. I did, and I got amazing love, care, and support. As one of my colleague friends in Kansas City shared at one of my public talks, let me tell you what it was like to be on the other end of Judy, and she did not mince words. She said, Judy asked for jokes, and I sent jokes. 3, work part-time if you can, and be as active emotionally, physically, and socially as you are able. Seek friendship and let your trusted friends know you need them. Talk about your fears, dying, sadness, upset, anger, or humiliation, and whatever feelings and thoughts you have. Not what you think you should feel and think, or what you think someone wants to hear. I told them if I wanted a one-way relationship, I could be a shrink or see a shrink. The emotional intimacy was astounding. When I got better, it amazed me how it changed back to regular talk. As a psychotherapist and psychoanalyst and an anal cancer patient, my professional knowledge was a valuable asset to help me with my recovery. Because I've spent decades talking about medical topics and topics that many think of as taboo, I was able to ask direct questions of my physicians and appreciate the answers, which were often uncomfortable and very scary. When I asked Dr. Doug Wong, he was the chief of colorectal surgery at Memorial Sloan Kettering, what exactly would be done and what were expected effects, he answered honestly and directly. I was prepared that I may never again have a sex life, as well as other unwanted effects, including the statistics on survival, recurrence, metastasis, and death. Upon leaving the appointment, I called the most respected and experienced physician psychoanalyst known for his work on trauma. I said, Dr. B, you may not remember me from previous correspondence, but I am about to be traumatized by radiation and chemotherapy to save my life. Will you see me when I get done? I recommend getting a therapist with experience as soon as you can and stay in therapy on an as-needed basis. I'm very grateful to so many doctors who took care of me. Dr. Goodman, Dr. Peter Yee, just incredible people who saved my life and listened to me and related to me. I think it's, and I can't not mention Ethel, the nurse who I got mad at because I didn't like what she told me because because it was painful. So I had to apologize to her later. But it's very important if you have a doctor who's not listening to you, if you can change the doctor, do it. If you can't change getting him or her to listen to you, it's really important to be with people you trust and whom you feel will help you get better. I joined the ACF peer support program because I wanted to give back. So many people like Richard Goldman and others in my Yahoo group helped me save my life and were always available when I had new rule outs and fears of recurrence or a new primary cancer. Laura Lazar hooked me up with the best butt buddy in the world, Pauline, when she received her anal cancer diagnosis in 2019. Since I was already about 11 years past treatment, she now helps keep me up on the latest stuff. She also takes care of me and follows me when I get scared that I've got a new HSIL and the lab result is delayed, or I just have to rant and rage about my anger that everyone and his brother are up my butt and that it is an exit, not an entrance. Some ways that people who are seeking mental health support can find it are getting a patient advocate, working with your primary care physician, the Association of Oncology Social Workers, using the Psychology Today directory. It's very important, though, to know whether you want telehealth or in person or both, and whether you require insurance in network or out of network, or whether you can afford self-pay. And feel free to contact me if I can be of any use or help to you.